let's talk dentures, and specifically I actually would like to talk about something in terms of dentures. There's lots of people out there. Apparently there are 30 million people out there who have dentures in the United States. But so in any case, many times they come back after a year, two, or whatever it might be, and the dentures are wiggle-woggly. They are, like a big boat. And people think the dentures are not, they kind of lost their function, when it was really that their mouth, their gums, or their bones were shrinking. Now, I heard from you, I think, that right now, since a while, with the invention of implants, we can literally do a hybrid. Get a denture, put a couple implants in it, which makes it much less expensive than putting all implants in it, 2 or 3 implants, whatever it might be, and then that denture apparently increases in functionability in terms of the way it sits and the way you can taste food and all those things like day and night compared to a normal denture. And even prevents the shrinking of bones, which then gives that dried out tomato look. Tell us something about that, because that sounds exciting to me for people who have dentures and who obviously do financial, means, can simply not afford to put in 15 implants.
Let's talk about somebody, first of all, who has a loose denture.
Yeah.
If the denture is still in good condition and they're happy with the way it looks, but is loose because perhaps they've lost weight or their gums have shrunk or their bone has shrunk, then there's a real simple procedure called a reline, where you rebuild the interior of the denture to fit the new shape of the gums. That's very inexpensive, and that's frequently all that's necessary to return that denture back to its original fit and condition. If the denture is in poor condition, well, then obviously you'd want to have a new one made. And you may end up having a new denture that fits great, and you're done. You don't need any implants. Now, for some people, they may have already been through the reline, or they may have a new denture, or just by the visual condition of their gum, you can tell that even with a reline or a new denture, that they're still not going to get the fit that everyone hopes for. In that particular case, placing a couple, 2 to 4 implants underneath the denture that are designed to support the denture may be an excellent option for them. What you have is an implant that goes into the bone, and there's a little snap that's fabricated on the inside of the denture, and when you put your denture in, it clicks in place. Instead of the denture being held in place by soft, movable gum tissue, it's held in place by rigid implants, and they are absolutely rock solid. And as you said, it's much less expensive than an entire set of implants with teeth. That can be horribly costly. And there's also a new type of implant that's designed specifically for dentures. It's called a mini implant, and it's a fraction of the cost of normal implants. It works very well.
Right, so basically a denture-supported implant, an implant-supported denture, that would be better, is rock solid, meaning you can bite into an apple, chew on a spare rib. Is that what you're saying?
Oh yeah, corn on the cob, apples, everything. Yes, absolutely.
Beautiful. That must be beautiful. And what about, because some people with dentures do complain about that they lost their taste spot, so does that come back with that because you don't need any more that big cover over the palate or so?
Yeah, this is interesting. You would think that most of your taste comes from your tongue, as we learned when we were young. But if you have a full denture which covers the entire roof of your mouth, there's actually a considerable amount of taste sensation that comes from that area. And when you cover that with a piece of plastic, you lose a large percentage of your ability to detect flavor. So if you have a implant-supported denture, you don't need to have all of that plastic on the roof of your mouth, and that can be removed. It can be removed from your existing denture. You don't even have to have a new denture made. Mm-hmm. And so you'll get a lot of the of your normal speech habits back. Certain vowels and consonants where we touch the roof of our mouth with our tongue, and also you'll get that full flavor back from your food. For those of us who don't have dentures, we don't understand how much of a problem that is for people, and how much they actually suffer in terms of what they can't chew anymore, what they can't eat anymore, what they can't taste anymore. It has an effect on your daily eating habits and your ability to digest food correctly if you're not chewing it the way you should.
Right, which is probably why, especially in the old days, we've seen, and maybe even now, we see people, once they have a denture, for some reason they feel a lot older because some of those pleasures are gone, and they associate that, of course, with, well, it's all over. And so basically it seems to have a very good moral effect on people also to not to have that. Now let me ask you, a person who comes in, you said with a denture, it's loose, it's however beautifully functioning, otherwise it's good looking, it's the perfect fit, all it needs a relining. Would such a person still benefit from putting a couple of implants in it and using that same denture implant supported?
Well, in that particular situation, I'd recommend that they consider having the reline done first. And if they were able to get a suitable result with that, then not proceed with the implants. Very frequently, that's all they need is a reline, and then they're very satisfied and very happy. If an individual came to our office and said, Dr. Michaels, I want implants, definitely want implants, and the denture doesn't fit correctly, we would still do the reline first, because you need to have a properly fitting denture if it's going to be implant supported.
Right.
So you can see how deciding to postpone the decision on implants is sometimes worthwhile. Try the reline first, and if you're successful, that may be all you need.
Got it. Because you can always upgrade a few months afterwards if you think that you want to go. Beautiful.
Absolutely.
Again, your candidness is very much appreciated, Dr. Michaels. Bye-bye.